Morning, good morning. Okay, so we are live right now. Today, I actually have the pleasure to meet here with Dr. Dokukin, and I reached out to him um, because I saw that he does leech therapy, leech medicine, and it grabbed my attention because that's something that I've never seen that or heard of that before. And so I reached out to him saying, wow, I love what you're doing. And, a couple of months after now, and I reached out and I said, hey, let's do a podcast. I think it's great, what he's doing. And it's something that I want to share, on LinkedIn, and not only LinkedIn, YouTube, and the medical community about these innovative therapies. So Dr. Dokukin, thank you so much for joining, for accepting my invitation.
No,
How are you today?
thank you. Yeah, thank you for having me. It's early here on the West Coast at 7:30, and we're talking about leeches. But on the West Coast, I hope you already had your breakfast before we start talking about leeches.
I did.
Some people may not appreciate how wonderful these species are, and a lot of the time, people say, "Oh my God, leeches! Yuck, you." But I hope to change minds actually in people in the country about this magnificent animal that has so much medicinal value.
Yeah, I think so, and that's why I reached out. So, the actual medical term it's called hirudotherapy.
So it is called hirudotherapy.
Hirudotherapy.
Hirudotherapy. Believe it or not, the leech extract. Here is the misconception. So everybody in the United States I talk to, they say, "Oh my God, leeches suck your blood." That's what they do, right? Because we even say, "You're like a leech. You're just sucking in my energy. You're sucking in my blood." Yes, it is true. They do suck in the blood, but the medicinal power of the leech comes from a totally another property of the leech. It's actually coming from the saliva.
Yep, an anticoagulant. I read.
It is a symbiotic relationship between a human and an animal. So the animal has to get fed, so it takes the blood. That's what it eats. It drains lymphatics. It has a tremendous therapeutic value in just the ability to drain congested tissue. But then it injects the saliva, and that is what the medicinal value of the leech is. The first compound that has been isolated from the leech is called hirudin. Hirudin was so when you apply the leech, the wound is going to keep bleeding, and is going to keep bleeding for about 12 to 24 hours, essentially. So it's an anticoagulant. It thins the blood. So I think in 1908, I think one of the scientists, I forget who it was, isolated that compound and they called it hirudin. Believe it or not, Oscar, we put hirudin on a stents in a heart, and we coat the stents with hirudin when we put the stents in. So we've been using leech even in this country, recombinant hirudin, for many, many, many years. But yeah, it is called hirudotherapy. That's what it's called.
I just looked it up. The primary scientist in 1908, Percy Moore. He was actually a zoologist. It says.
Wow, yeah. So I was pretty close, huh? 19. Wow, I was pretty close. Cool. I still remember my history. So
Yeah, that,
that's why we called it hirudotherapy. But later on we realized that it has many, many more compounds. I think it has about 40 to 60 compounds, depending who you read. We can break them down. We'll probably go over some of them later, what they do and how they're being used. But that's the name, hirudotherapy. Yeah.
hirudotherapy. Okay. Yeah, I think the most important thing, is for someone that is new and has never heard of this, including myself. Before I did a little bit of research and realized that it's actually FDA approved, and we'll get into all of that. But what is leech therapy? How do you use it in your practice? What made you even focus on it, right? Like what made you, because I know we were talking right before we went live, and you were telling me that you did PRP therapy and all of that stuff. So what made you kind of go from there as well? Who makes a good candidate when it comes to patient? Like, just walk us through the whole entire process of leech therapy, which is, I'm sure, a lot of people will find a lot of value.
So let me give you a little bit of a history.
Yeah.
Humans use leeches for as long as we have records of humans receiving any medical care. The Great Pyramids in Egypt have leeches actually um, depicted within the pyramids. The story goes that Nefertiti could not have a first child unless she was treated with hirudotherapy. I think Alexander the Great was the father, but and we're talking about 3,500 years ago. That's when the first records date to. Somehow I think the humanity used leech way before that. Fast forward to 1800s. What did we have in medicine? Nothing, right? We had arsenic. We bled people, and guess what? We had leeches. So the end of the 18th century, the beginning of the 19th century, hirudotherapy was very, very popular in Europe. Let me backtrack. Let's go back to Egypt. So the history suggests that the hirudotherapy migrated from Egypt, it was an ancient Arabic medicine. It went to the Ottoman Empire, modern day Turkey, where it is still quite active and it's being used. Then it became ancient Persian medicine. It continued it trip to India, where it became part of Ayurvedic medicine, and it is a big, big part of Ayurvedic medicine. In the United States, the Ayurvedic schools do not mention hirudotherapy at all, but
Interesting.
in India, this was part of original Ayurvedic medicine. In China, of course, we know the Chinese as an acupuncture, an ancient Chinese herbal and acupuncture medicine that we call it traditional Chinese medicine.
Yeah.
Well, ancient traditional Chinese medicine did use leeches. If you ask your acupuncturist these days, they do not know what you're talking about. So the history of the leech then goes a little bit further up north, and that's when it starts hitting the Caucasus. We're talking about Azerbaijan, the modern Turkmenistan, Azerbaijan. These were actually ancient Persian territories that Shah exchanged with Russia for something back in the days. And then the therapy actually moved all the way back to what we have now is a mainland Russia. And the only school that remains, the only medical school for hirudotherapy is in Russia. Russia has a couple branches, the St. Petersburg school and the Moscow school. It has slight differences in their opinion. I actually did my training in what's called Altai region, which is close to Siberia, between China and Siberia. That's where I've learned my hirudotherapy. So the history of the bug is fascinating. We used it initially for bloodletting. So we would attach the leeches, and we thought that by letting the blood, you would get a medicinal benefit. We did not use the leech; we just bled people. Remember, I think we bled one of our presidents to death when we were trying to save him. I think it was Lincoln, if I'm not mistaken. But a lot of famous people were treated with hirudotherapy back in the days. So the 1900 hospitals in France used a million leeches a year. Hospitals in England used millions of leeches a year. The leech itself, so there's not one leech, Oscar. There are about 600 species of leeches. And obviously none of them are, except for three species, are used for medicinal purposes. So there are only three leeches. One is called Hirudo medicinalis. The other one is Hirudo medicinalis officinalis. Third one is the Hirudo medicinalis orientalis, are used for medical purposes. And that has to do with the fact that only those three species will actually have a therapeutic saliva. Some of the other species will have therapeutic saliva, but the characteristics of the saliva are not the same. Another species which is used commonly in the United States is called Hirudo verbana or verbena. I'm not sure how to pronounce it. If you go to Philippines and Indonesia, modern day Indonesia, you would have other species that people are using therapeutically. But again, for human medicinal purposes, Hirudo medicinalis, medicinalis orientalis, medicinalis officinalis are the only species which are being used. Then the history goes that because of the popularity of the leech, back 1900, we didn't have anything. So that's what we did. The doctors just had leeches. We used them for anything and everything. And a lot of the time it was helpful. A lot of the time it was not helpful because guess what? The leeches were not indicated back then. So we outfished them out of the wildlife. So the Hirudo medicinalis is a protected species. It's an endangered species, and you now have to produce it in biofarms, in actual farms. So
Mm.
they still exist in wild nature in some parts of Russia, southern Russia, Ukraine. Um, to the best of my knowledge, you cannot fish them. So the only way to get the leech now for medicinal purpose and to use it would be to buy it from a farm which actually cultivates them.
Okay.
So that's a brief history of the thing.
Interesting. So going back, so there you said that the only school as that you know as of now is in Russia. There's none here that educate in the United States.
No, Oscar, I really,
Oh,
really hope to be the first one to establish something here. There is a woman in Florida, actually. She's a registered nurse, and she does teach it. She's very, very knowledgeable, but it is a more of a private effort. You want to come and learn hirudotherapy with me, come and learn it. I'll teach it to you. I'm sure
gotcha.
there are a few more practitioners in the U.S. which are doing the same thing. But what I'm talking about, an effort to actually establish a true curriculum, a true school, and I am in the process of putting that in place. But it's not easy. It's a little bit hard.
I'm sure.
Yeah.
I'm sure it is. Well, the fact that why is it hard? Because the fact that it's FDA approved and there's medicinal, value. Why?
Yeah, good point. So, yeah, interestingly enough, it is FDA approved in the United States.
Okay.
In 2004, Leech therapy got an FDA clearance. And I will tell you the case specifically. It will illustrate how the leech works and why it is approved. So, imagine this is actually a real case. A child's ear was bit off by a dog, and then you reattach the ear, which is cartilage, back to the skin, but the ear does not it does not attach itself surgically. Why not? Because you're talking about a tissue which has very, very little vasculature.
Right, yeah.
It's a cartilage. So how do you reestablish the circulation within that place? You really can't
That's
with
true.
anything, but leech will do that because leech, what it does, it thins the blood, it takes out the congested tissue, and then it reestablishes the circulation. So
Mhm.
with its saliva, it thins the blood and it thins and gets rid of all of the blood clots in the tissue. Then it drains it because it wants the blood, but it also drains the lymphatics and it drains the interstitial fluid, which is a fluid between the cells. So it kind of removes the garbage in between of the cells. And then that allows the circulation to jumpstart again. Then it injects the saliva that promotes new vessel growth, that promotes new circulatory processes, and this is how things get reattached. So FDA looked at this case and they were like miraculous. Truly, truly miraculous. So they approved it for plastic surgery in the United States only. So, for instance, if you're trying to reattach any kind of a piece of tissue to the human body, you can use hirudotherapy. One of the common things, let's say a woman would have a mastectomy and then they would have a flap procedure. They would take some of the muscle and then put it back to the chest wall. How do you drain that muscle that has been cut from one place and reattached to another place? What do? You use leeches to reestablish the circulation. You drain the venous congestion because that tissue doesn't have active circulation. Another kind of a funny thing, people do have injury to a male organ. If you're trying to reattach a penis, for instance, penile tissue,
Yeah.
you will use leeches. You try to reattach a finger, use leeches. You're trying to
Really
reattach
interesting.
anything, you use leeches for that purpose.
Hmm.
Uh, but what the FDA did not clear it for is the rest of the medicinal value of the leech. And the surgical benefit of the leech is just a very, very minute minority part of the therapeutic application of the hirudotherapy.
Yeah.
But the
So I did a
principle,
little brief research, and it says that it's like it's considered a device instead of a drug.
yeah, in the rest of the world,
Yeah.
hirudotherapy and the leech is considered to be medicine.
Yeah.
In the United States, it is a device. So
Yeah.
legally, it has very interesting implications. So if I'm a plastic surgeon, I will need to have a special clearance from the hospital. I would need to do an additional training in the hospital to apply the leech post surgically in the hospital to the patients. At the same time, because it is a medical device, Oscar, I will teach you how to do this, and you can do this completely legally in the United States
Without a medical license.
without medical license. I will tell you, your mom can do it as well when she's in Miami and when I'm next time visiting Miami. I will teach your mom. She can do it without medical license. It
Oh.
is bizarre, and people take advantage of it. And a lot of the people would use this technique. It has good things about it and the bad things about it. The good thing is accessible. For instance, in Turkey, until recently, it was also considered to be a medical device. So if you travel to Turkey, anybody will leech you. But the way they do it has nothing to do with the actual medicinal medical school and the protocols.
Yeah.
So they just recently changed the law. So, but in the United States, because we don't do this at all, initially I welcome this approach because I would like to teach every single nurse, every single naturopathic doctor, every single chiropractor, acupuncturist, phlebotomist, anybody who has a clinical license to touch a human being, I can potentially teach. But of course, one has to understand medical pathology and has to understand a little bit what you're trying to accomplish to use it effectively. So it has good things and bad things about the fact that it is a medical device. But yeah, so we're lucky that way.
Yeah, I mean it's good. I personally I would prefer, someone that knows what they're doing to leech me,
Yes, yes, I agree with you. I 100% agree with you. They encourage. Again, I even hired an attorney to change to check this out. And like with any medical device, you're supposed to have a prescription from the doctor. So, like, let's say a medical device, a TENS unit, a transcutaneous electric stimulation unit. Can you buy one on Amazon and use it on yourself? Yes, but it is much nicer to use if a doctor told you, look, this particular therapy, number one, is not going to harm you. Number two, this is how you do it. So legally, one still needs a prescription from the doctor, but because doctors don't know what it is and don't know how to write the prescription, therefore we're stuck in this kind of a place where you know
Yeah.
anybody can use it essentially. Yeah.
Okay. Yeah, and I was, doing additional research, and I was also on your website, and there's a lot of different treatments or therapies that you can use leeches on. So I saw headaches as well. You for joint pain, inflammation. Obviously, how do you currently use that in your practice as well?
Right. So look, I actually probably there are two medical doctors in the United States that I'm aware of, which are licensed. There is another physician from Russia who is not licensed in Arizona, to the best of my knowledge, who is also using it. But there are two medical doctors. One is actually also in Florida. I've never met her. Um, but she claims to use hirudotherapy, and it's myself. There's nobody else. There is a lot of nurses that are using it, mostly people from either Soviet Union or from Poland or from Eastern Europe. But to understand what a leech can do, one has to understand what the saliva has in it. So saliva has an anti-inflammatory in it, a painkiller in it, uh, growth factors in it, a substance which can modulate immune response. Um, we also call it a biological scalpel. Why? Because it can break down scar tissue
Mm.
superficially and deep within the body. So you can reestablish blood circulation to pretty much any organ inside of your body. So we use it mostly for internal medicine, neurological issues, musculoskeletal issues, immunological diseases. We use it for gastrointestinal issues. We use it for, it can be used for eye disease. It could be used for gum disease. It could be used for cardiovascular system. Believe it or not, leech can be a natural stent for the heart. I can accomplish a cleaning of your arteries in the heart with hirudotherapy. I can
Wow.
lower blood sugar. I can lower blood pressure. I can boost immune response. I can deliver painkilling. So the amount of what you can do is absolutely stunning. The one of the books that I'm a big fan of, they basically say that almost 90% of human pathology can be treated, assisted with treatment by treatment of hirudotherapy. Hirudotherapy is not necessarily the primary treating method for anything, really. Even for plastic surgery, look, you're not going to put a leech. You have to surgically do something to the tissue, and then you use the leech to help.
Yeah.
It's exactly the same way it works with the rest of the pathology. There are few things that you can use hirudotherapy as a monotherapy. We can talk about it later. Since orthobiologics are very close to your heart, I can essentially treat osteoarthritis of the knee with a leech as a primary form of therapy, and people would have pain relief for years and years, for months at the time. Some people would have pain relief for years at the time. You don't
Interesting.
have to inject anything. It can be applied externally, and this is one of the most researched subjects in non-surgical hirudotherapy is actually treatment of osteoarthritis. But
Really?
again, yeah, you
Hmm.
pick a body part, you pick a body system. I will tell you what I can treat for you.
Interesting.
It's stunning what you can do.
Wow. Well, the most common, is knee osteoarthritis. That's the most common. Everyone has issues with their knees.
Yeah, yeah, yeah. So what you do basically with hirudotherapy is, look, it is not going to give you a new knee. It is not going to restore anything. It's not going to restore the cartilage. It's not going to restore anything. There are a lot of things that people think that by injecting stem cells, by injecting hyaluronic acid, something is going to anatomically change. No, hirudotherapy doesn't say so. It doesn't promise so. The way it works, it is still not very well understood, but you can think of it as as a delivering saliva to the nerve endings, to the tissue of the knee, inside of the capsule, inside of the joint, and essentially modulating the pain response. Uh,
Hmm.
the clinic where I've trained in Russia, I'll give you the statistics. So it is a rather far away city from Moscow. Uh, you can get a hip replacement, let's say, for hip osteoarthritis, but you have to wait about a year to get the surgery done. So what people do while they're waiting for the surgery for the hip replacement, they come to the hirudotherapy clinic. Guess what the statistics say? Statistics will tell you that 30% of patients who come to the hirudotherapy clinic to take care of their hip pain, 30% of those patients will never go to the hip replacement
Yeah.
because their understanding is, why do I have to get a surgery when I can just come 2 times a year, maybe 3 times a year for a few sessions and get my pain under control? Now,
Interesting.
plenty of times you know very well that people will not be a candidate for a surgery because of either poor overall medical condition. People don't want to have a big surgery. Knee replacement is a big surgery. Hip replacement has a very fantastic outcomes. But if you're trying to replace the knee, you have to really consider, whether the person can tolerate the procedure. So yeah, you can use hirudotherapy easily, 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 easily. It eliminates the pain. Sometimes I would not claim that in my personal experience it would alleviate it 100%. It never 100%, but you
Nothing
can,
is really 100%.
you know, you can get pain relief up to 80%, and you can return patient back to normal function with very significant amount of comfort. That person will not even think of the replacement of the knee, or at least will be able to postpone it if needed to
Yeah.
be. So
Interesting. So in your practice, what is like the most that you see, like, or you treat, like what is, what are the most, common? Because I'm sure you have a most, more common that you treat, and you're like,
Yeah.
this is what it's best for, and my expert.
Unfortunately, the what it's best for, I don't
Hmm.
see much
Okay,
because
interesting.
people. So I'm in Los Angeles, right? So in LA, we have a large Armenian community. We have a large Southeast Asian community. We have a lot of Latin community. So I get phone calls not from the people who grew up in the United States. Most of my phone calls I get are from people who either came from Turkey, Azerbaijan, Armenia, Mexico, people who have done hirudotherapy back home and they want to
Mhm.
do this here. That's how they
Interesting.
seek me out. So most of the requests that I get would be, "Hi, I'm here to do hirudotherapy." My first question is, "For what?" They're like, "Oh, for general purpose." I welcome those clients, and yes, it can be done for general health maintenance purpose, but that comes from people who like to stay healthy, who like to keep improving their overall general health.
Yeah,
I love these clients because they're the easiest, because you can essentially do a couple protocols here and there, and they're happy, you're happy. But my
yeah.
true passion is to help true pathology, like true things that cannot be done.
Interesting.
I'll give you an example. So a woman who had a breast mastitis, an inflammation disease of the breast tissue, comes to me. She's Turkish, and she was treated with antibiotics, with minor surgical procedure, and finally her surgeon said, "Look, there's nothing what we can do for you. We're going to give you a partial mastectomy. We're going to take half of your breast away, so you don't ever have to get this." Now, for a woman who is 38 years old, taking a half of her breast off is a it's a drastic proposition. So she calls her mom, and mom says, "Well, don't be silly. Come to Turkey and do leeches." So instead of going back to Turkey, she found me. She came, got treated. Guess what? No more mastitis. A person comes to me with an Achilles tendonitis, for instance. They had this treatment, they had steroid injection, they had modification to their shoe. They came in, we did two treatments, Achilles tendonitis gone. Um,
Interesting. So obviously you how do you diagnose that, and how do you decide, like, okay, where to place? Obviously that comes with your protocol, but like what's
that's where the school comes in. See, that's what's
gotcha.
very important. So it's not just as easy as throwing a bunch of leeches
Yeah.
on the plate.
Yeah.
Funny enough, I don't know if this is an appropriate story for you or for our audience, but who cares? I will
Eh,
tell you anyways. It is remember I told you that usually primary therapy is something else, and leeches come secondary. But when it comes to erectile dysfunction, this is primary therapy. Why?
so we do a lot of sexual rejuvenation as well. It's
Yeah.
very it's big.
It's huge. It's
Yeah.
huge.
Yeah.
So what people do, people take Viagra, people take other medications, right? So why? Because you want to dilate the tissue, you want the blood allowed to come in.
Okay.
Well, guess what? When the medication stops working, the tissue, nothing happens. This is the primary treatment. I can permanently deliver blood supply to an organ with hirudotherapy.
Wow.
You don't have to take any pills. So the
Interesting.
biggest fear of the people, they're like, "Oh my God, are you going to put the leech there?" I was like, "No, you really don't.
Interesting. I see
You
what you're
really don't."
saying.
But as long as I can deliver the saliva to the organ, and I can deliver it through the vessels, which are you have to understand the anatomy, you have to understand the blood supply to the organ. But usually the school tells you one thing. So first you have to prepare a person for hirudotherapy. So you don't just come in and throw the leeches there. By the way, I brought you some leeches. Uh, this is what they look like. I have to show you these things.
Nice.
Um, but yeah, you number one, they have to understand that this is going to be an animal. It's going to come bite you. You're going to feel a bite, and then it's going to suck the blood, and then afterwards it's going to bleed, and that's normal. You don't have to go back to the emergency room, try to sew this up or anything like that. You have to evaluate general medical condition of the person. You have to understand very few contraindications to hirudotherapy. You have to understand that there are few, but they're very important. If the patient is a bleeder, if the patient doesn't have enough blood in the first place, if the patient has cachexia, If the patient has certain conditions that in the United States I'm not going to touch, for instance, cancer, I will not touch cancer.
Well,
I'll tell you,
yeah, from PRP also has contraindications as
of
well,
course, yeah,
and they're pretty much almost the same ones that you mentioned.
yeah,
Just
yeah,
you know,
exactly,
yeah,
exactly, exactly, exactly. So then I will have to look at their medical history and understand what I'm trying to accomplish. Because the leech, 30% of what leech does is going to be happening focally, right there at that place.
interesting.
I'm sorry, forgive me. 70% is going to be happening focally. 30% is going to be systemic. Once I deliver the juice, the saliva, we call it the juice here.
Yeah,
Once I deliver the saliva, 70% is going to be happening right there around the area, but you also have it in the circulation. Now, once you have a medication in the circulation, you better know what that medication is going to do to you. So I have to think to myself, can this person tolerate it? How many leeches are they going to be tolerating it? What is going to be my plan of treatment? Leech therapy is going to shift fluids from one part to another part. Because if you're going to drain fluid and establish a venous congestion drainage from one part, you will affect other systems of the body. Do you really want to drain something that you don't have enough blood supply in the first place? No, you have to think. You cannot just jump in and start draining things. It's like a plumbing issue. You have to understand your entire plumbing structure before I can't just cut out a piece of pipe without knowing that there is a pressure from the water. I
yeah,
have to know how much pressure, where is the pressure coming from? If I drain that pipe, what's going to happen to the second story? Will they have the water up there? No. So I have to consider this. Only then you're going to say to yourself, okay, now I have a plan and understanding how the piping works and what am I going to be doing with the fluids. Now I'm going to say, can a person tolerate it? So we usually start with very few leeches, maybe 2, 3, sometimes 4, to see if the person may have an allergy. Patient may have an allergy to the saliva, not
interesting.
to the bite itself. The bite itself is going to look like it's an allergic reaction, but it is not.
Okay.
So
Does
I
it
have
hurt the bite?
it itches.
Okay.
It's like a big mosquito. It's going to
Okay.
bite like a big mosquito. You will feel it. And for
Mm,
some people, in some parts of the body, it could be a little bit painful. Like let's say
interesting.
feet, hands could be mostly feet could be a little bit painful. Uh,
Interesting.
so you have to understand. You have to prepare the person. Then once you determine that the patient is going to tolerate, again you have to think how to pre-treat the area. If you are treating pathology above the diaphragm, most of the time you're going to start with the liver decongestion. Sometimes you would actually flip the person around and you will treat the sacral area because the sacral area drains a lot of the things from the head down through the cerebral spinal fluid and etc. Some of these concepts, Oscar, are going to be somewhat foreign to the doctors who are trained in the Western medical tradition. And a lot of the concepts in the school, they correlate with acupuncture, they correlate with Ayurvedic principles, and they correlate with ancient medical practices. So if I start explaining this to a Western medicine trained physician, people may not even understand the concepts,
Interesting.
or they may think that I'm making stuff up. And you know what? That's fine by me, but I know that it works, and using the school does work. Therefore, education and having a true curriculum and true school is very, very important when applying hirudotherapy. I
No,
don't
that
know.
makes
It took me to get to some other topics, so forgive me.
no. This is all very helpful. No. This is very helpful. This is amazing. So obviously, that when you assess the patient, depending on what their injury is, or what they have, that's when you come in and you create the protocol. Usually, how many treatments is it? Is it just
Yeah.
multiple
So
treatments?
another thing, very, very important. With most of the treatments, our consumer-oriented patient population, which includes myself, I'm a medical consumer as well. Give me a pill and I'll be fine. Oh, give me a procedure, I'll be fine. Fix this for me, and I'm gonna be okay. Go clean it up, I'm gonna be. No, people have to understand that this is a process.
Yeah.
Yes, I can treat few things with maybe with 2 3 sessions for sure. But a lot of the time, if I'm trying to accomplish something much bigger, let's say if I'm treating a diabetic person, and if I want to modify their weight, I can probably shed about 10 15 pounds by just doing hirudotherapy with them. If I can restart their pancreas by revascularizing the area, that's going to take a few months. I can modulate, believe it or not, even not related to diabetes, I can modulate thyroid glands, I can modulate pineal glands, I can modulate adrenal glands, I can modulate your endocrine system, but I cannot do it in one session.
Hmm.
So the treatment is prescribed sometimes as 5 sessions, 10 sessions. And my patients, at least here, they don't understand that. They don't want to participate in this. Back home in Russia, whatever the doctor said, you're going to be coming here twice a month for the next 6 months, I would always abide. My parents would always abide. But here, people, if they don't have an immediate pain relief or they don't have immediate effect, they're like, oh, this is nonsense. And especially when you're talking about leech treatment, it's like, okay, this guy wants to do snake oil on me, and after one session, nothing happened to me. He is obviously full of it. But it's in a way like acupuncture. It's a powerful treatment, but one may not expect
Yeah.
an immediate results. So
Yeah. I was going to touch up on that. You made a good point where, I feel like a lot of Americans in here, we just want something done, one pill, one injection and done.
yeah,
And unfortunately, I mean, we can do that like that. I mean, not in leeches, but in other things. But, you know, you also need to make some lifestyle changes and to get the full effect of any treatment, right? And so, like, for example, like, what would be what lifestyle treatments or changes do they need to make, right? Like some examples, right? Like I know, with so many different therapies but like what are some like very like what does diet affect them? Does mental affect them? Like what are some.
I'll give you a simple example, the simplest thing of all, but it applies to pretty much anything and everything. So
Yeah.
this gentleman comes to me with Achilles tendonitis, with an inflammation of the Achilles tendon on the foot.
Mm-hmm.
You know, our Western medicine is designed to treat the Achilles tendonitis very appropriately, right?
Correct.
Okay, how are we going to treat it? We're going to deliver some anti-inflammatory medication here and modify the tendon. Well, did you address the problem? No, you didn't even touch the problem. The problem is not Achilles tendonitis. The problem is that the patient's foot is pronated.
Mm.
The problem is that the patient is a surfer and he uses that foot as he jumps on the surfing board every single time. The problem is that patient plays tennis almost on a daily basis, competitively, wearing shoes which do not support the pronation. His Achilles tendon, instead of being straight and attaching to the calcaneus, it is bent like this.
Yeah.
So it's constantly
So
has
it's
this.
mechanical.
It's a mechanical problem. Unless you address the problem, you can never address the Achilles tendonitis. Yes, I can put the leech there and get rid of the pain. That's why he loved the treatment because the pain was gone. After after first Achilles, I had to pre-treat his liver, or I think I did the coccyx. I don't remember. But the second session was directly directed to the Achilles. Yeah,
Yeah.
the pain was gone. But guess what? Did we address the problem? No. And that talks, and this applies to everything in medicine. Here
Yeah.
in the United States, the Western medicine, we put a band-aid. You give me a symptom, you have pain. Here is some oxy for you. Okay, you have a shoulder. Here is an injection for you. Did we address the problem? No, we didn't. So, same issue.
I agree 100% with that. Yeah, I agree with you. Okay. Yeah. So the sessions depend. So that's awesome. So then, so similar to a story, one of the doctors that I trained that trains with, he actually told me a story very similar to yours that he had a patient that had gone to many orthopedic surgeons, doctors, and they couldn't find. He had, I think she had a hip problem. The patient, excuse me, and went to many orthopedic doctors, sports medicine, and they couldn't find out nothing. I mean, nothing was gone. So she's like, hey, so, and he started just asking questions about mechanical, right? Going, that's why when you said that, I'm like, mechanical issue, right? And so what happened was that every morning she walked on the beach on the sand one way, right? But then on when once to go back home, or she would walk on the sidewalk. So obviously, as you know, the beach is side the sand is sideways. So go walking every day. So her hip or her knee, was kind of, the weight bearing was one sided.
Yeah.
So she's like, listen, she's like, no, do. And so what he told her was, walk the other way, and you have to fix that, and that's it. And
Yeah.
I don't know what he did during the session, but and then she's like, really? And then she did that after like a couple of months after doing that, she was fine.
Yeah. 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 It's amazing what happens to you once we address the actually underlying cause. But our medical system, the reimbursement of our medical system is designed not to do that. The reimbursement of our medical system is designed exactly to do the opposite. By the way, talking about reimbursement, this is not covered by any insurances.
Okay.
Hirudotherapy. In this, obviously, if it's a surgical procedure in the hospital, it will be covered. But for everything else that we use, it's not covered at all. I don't foresee things changing until the research is there. Nobody is conducting any research right now in the United States on a larger scale about the effects. There's plenty of literature. Oscar, I'm gonna show you the amount of books written on it. Um, this is just a half of the books that I have. Trust
Wow.
me, about hirudotherapy. But you can see this is all, my friend, is not in English. This is all Russian. Some of these things are translated. There's only one book.
Wow.
We're not doing anything in the United States. The
Wow.
field is wide open, and it is so exciting because of that. There's plenty of literature written. Most of the studies come from either Russia. There are a few studies in Germany. There is an excellent book in English with most of the research coming from Germany, and it's written in Germany. Some European studies, some Turkish studies, some Indian studies. But in the United States, the field is wide open.
Wow. It's a great opportunity.
It is an amazing opportunity. It is. I truly, truly hope to establish some kind of a school, share the knowledge, and I am currently applying for a grant. I hope the person who will be helping me with the grant is watching us right now, because she will need to understand how this operates. But yes, in the United States, Oscar, this is an amazing opportunity because it's wide open, completely wide open.
That's great. Well, you look very passionate about it, very knowledgeable. So I'm hoping I can collaborate as well, and
I hope
somehow,
so. So,
um, something that I do want to touch up on is, so obviously you can't just buy any leash, right? I'm sure there has to be a process, if you can kind of walk us through, like, I know you said that there's three different type of species that they're
yeah.
medicinal. So, you don't have to share with us like where you get them, obviously, but like how's that process, right? The farm, all that stuff.
Yeah,
Yeah.
yeah. So when I started doing this, I was under the impression that there are true biofarms in the United States. There are a few places that you would go online. You can actually do Google search, and you will find the leeches there. So we used to order from the place in New York. It used to be, it was called halalleeches.com. The reason the leeches are halal because they were fed halal blood of the halal animal. That's the only reason. Uh,
Interesting.
yeah. So I thought that there were people in New York, because I know how the leeches are grown in Russia, right? So I know that they're being in tanks and they're growing them and they're multiplying and you're selling them. That's the impression I had. Then I met another individual in the Colorado, David Salas with North American Biopharma, and there are a couple other places that I've learned about. So I truly thought that there was a market existing. Little did I know, Oscar. Little did I know. Most of the stuff is a black market. It's a black market in the United States. So none of the places which sell leeches in the United States grow leeches in the United States. All of these leeches are imported in the huge crates. They come and they clear the customs either in Miami or Los Angeles, and they
It
come in free
hurts.
freight by millions, and they're being delivered to these places, which are essentially just keep them alive, in containers, in the larger containers like this,
Yeah.
and they just resell them. They resell them to the consumer.
Interesting.
To tell you more, almost all of the leeches that you buy are actually not the same species that you would need to use medicinally. The reason for that is it is complicated to import Hirudo medicinalis because it's an endangered species. You have to have specific paperwork, and it is not easy to obtain. So back in the days, people would ship the leeches. They would slap another label on the leech. They would ship it as a verbena and claim it's medicinalis, and the other way around. So the authenticity of the most of the leeches sold in the United States cannot be traced unless you really, really know the species, what they look like, and how they behave. The surgical leeches are being distributed by a couple companies. I think one of them is located in South Carolina. Those leeches are imported from Europe, from a very reputable farm in France or England. I think in France. France still has one of the few places in the world which they're being farmed. So they buy them from France with a permit. Russia has a lot of farms, but of course, with the sanctions and our terrible relationships, you cannot really import them from
Mm.
that part of the world. So the whole leech business is somewhat of a black marketish. So we are in the process of establishing our own leech farm.
Nice.
They're not hard to grow,
Yeah.
but yes, they have to be tested. They have to be certifiably imported to start with. So there is a process. There is a
Yeah.
process. But the scrutiny for everyday use for people like myself doesn't even exist. Essentially, I can
Interesting.
buy a leash from anywhere, apply it, and there is no regulations. Again, that field is also completely open. It's a good thing, but yet it's a bad thing because you will probably have a lot and a lot of people selling you things that are
That
not
is not
that
the
is not
right thing.
product. Yeah.
Yeah. So if it's not regulated and it's kind of like you said, like a black market, so when you purchase them and it gets here to on the United States, like how do you know? I mean, I'm just asking, right? From how do you know that they don't have any disease or they're bad? Like they have any disease or can transfer something like that?
Yeah, you don't. Here is the funny thing: you don't. So the leech has antibiotic in its saliva,
Okay.
so you can never infect anyone with a leech because the leech, by its definition, if it's one of those leeches used for medicinal purposes, even if it's not medicinalis, even if it's a verbena, even if it's some other species, they would have an antibiotic because the leech itself doesn't want the host to be infected. It is not it is not
Mm,
good for the leech because the leech wants to keep help the host to be well. So that's why you will never have an infection from the leech bite.
interesting.
You can have a superimposed infection if you don't keep the bite clean. So when you take off the leech off the skin, yes, if you put infectious material there, and if you have a poor immune system, yes, you can have an infection. But
Gotcha.
the leech itself will never infect you if
Interesting.
the leech has been kept hungry for 3 to 4 months. Leech has one bacteria. I think it's called aeruginosum, um, something about the water. I forget the name of it. It has one bacteria in the leech, but again, that bacteria does not. It helps to digest the blood, and it helps to produce some of the juice of the leech, but that bacteria itself does not go into the salivary gland of the leech.
Is it called Riconella? Riconella? No.
No, I think the further research which was done showed it to be some different species. But again, I'm not that up to date on
Gotcha. Okay.
the pathobiology of the
Interesting.
leech. But leech will have a naturally occurring bacteria in the gut, like humans do.
Yeah.
But it's only one species, and that cannot get. Number one, it cannot infect the human. It's not pathogenic to the human. Number one, And number two, if you keep the leech hungry for 4 months, it will not be transferable to
Wow.
the human.
So, wow. Okay, good. So you mentioned a couple of good things. So you mentioned that when you get them, when you receive them, it's you getting like all sorts of different types of leashes, right?
Usually you would get one sort of the leech. Again, most of the places where you would buy them, and there's only one place currently which sells them, because something happened to the regulations, and I think because
Mhm.
of the sanctions, the leech supply has completely dried up. Only North American Biopharma has the leeches right now, as we speak. I
Oh,
actually, Dave Salas delivered me his last leeches from his last batch, and there was like none to be found in the entire internet world.
oh.
Maybe
So
somebody had them.
got it. So when you receive them, you check them, right, to make sure that they're the medicinal ones, and then you also mentioned about
You
starving
hope
them.
that they're medicinal ones. You
Oh,
hope.
you hope.
You hope. You can't check unless you
So
know exactly what they look like. I know.
got
I
it. But so for example, the company selling them to you, they don't check. Like they don't check. They just sell and you
they
have a surprise box.
no, they do,
Okay.
Oscar, but they have to know, and you have to trust them that they know.
Mm,
The reason I think it's became very hard to now bring them through the customs, because in the customs they're actually implementing genetic testing now these days. So if I send a leech, it's one species, but I label it as something else to come into the United States without the proper paperwork, because it is an endangered species. You have to have a
mm,
separate license. You can't just have a normal import permit. You have to have an export permit from the country of origin, and then you have to show that these were grown in a lab and not in the wild. Then, I think they use genetic testing. So the customs know, and
gotcha.
the buyer knows. The buyer knows because they're in the business. But
Yeah.
then it is between me, it is actually on me as the medical professional
Yeah.
to take a look at the leech, because I know what they look like,
Yeah.
the color of it, the patterns on the leech.
Yeah.
That's what. So I do know. But again, can you fool me? I'm sure you can.
Yeah.
I'm not a biologist by training,
Yeah.
So am I going to do genetic testing on the leech? No, I can't. I mean, I could, but I don't even know where to start. So
Yeah.
my best chance of getting the best product is to make my own.
I agree 100. You trust it. You know what you're doing. It
Yeah,
makes
yeah,
sense.
yeah.
And then you mentioned one thing too as well that um, I think from the bacteria side, right? That you have to starve them 3 to 4 months. Do you do that, or does the company do them?
The company do that. So when the leashes arrive, they're hungry. They haven't been
Yeah, they
fed.
haven't been fed.
Yeah.
Yeah.
Once you feed the leech, it can go about 6 months without eating.
Mm.
So they have to be hungry, because
What
if
do
they're
they
not
eat?
blood,
But, like, so what type? Like human blood?
human blood, animal blood, they will even latch onto fish and drink fish blood if
Mm.
needed to be. But yes, it's blood only. That is a blood sucking
Interesting.
creature.
That's interesting. Okay. Yeah. I mean, that was a rhetorical question, but okay. Yeah. So, okay. Wow. So, yeah, this is great. And then, so since how long have you been doing this for?
I've been doing this for almost 5 years.
Mm,
Almost 5 years, and it's a slow progress. It's a slow progress to explain to people what you do. It's
yeah.
slow progress for people to understand what you do. I thought for some reason that I'm going to put a placard outside of my office and say, "Come and get your erectile dysfunction treated," and I'll have a line around the corner. You can watch me on the TikToks and the social media, but that hasn't happened. Nobody wants to be treated with leech. I different approaches. I try to educate people on it. People do come, but it's slow. But people who do understand and who value, they get tremendous benefit. But about 4.5 years I've been doing this. Yeah.
Okay. Wow. That's good. And then, so now, obviously, when you see medicine and where it's going, I come from from PRP, stem cells, autologous birth tissue. So that's kind of my realm. And how do you see, I know we're really behind compared to other countries. How do you see leech therapy fit in medicine now, right? Like how do you see how it fits?
Yeah, Oscar. We've had it for thousands of
Yeah.
years. There was nothing wrong with the approach.
Yeah.
Now we know more about it, and now we can use it better. We even can get an extract of the leech. It is an amazing medical product. But economically, my friend, there is no money in it for anybody to promote it, because even in your realm with the PRP, there's still equipment involved. Okay, with the stem cells,
Training.
depending on the company, one company sells you this batch, that company sells you this modification, third company, there's money, there's transactional money involved, because people, it's all about economics in medicine in this country.
Yes.
It's not about the outcome,
Yeah.
believe it or not. It's not about the health outcome. And because of that, the leech has been kept untouched, because you cannot make money on the leech unless you have a farm. And hopefully, you can still make some money on the farm as well. But that's not the main purpose, and it's
Yeah.
not the answer to your question.
Yeah.
We should be using it. Why aren't we using more of psychological and brain therapy, and things like Buddhism in our practices for psychological issues? Because you don't make money. It's much simpler to go to a psychiatrist, get a pill, take an antidepressant. It's much easier to go somewhere, get some kind of an injection, and it also makes money. That's what the economics are. So it does not really fit well with the economic model of our medical system, but it fits perfectly in this complementary medical world that we call complementary, or even the worst word that they use, alternative. No, I'm sorry, this is not alternative. This is the real stuff. We've used it for thousands and thousands of years. So it is belonging to the class of biological medicine, medical interventions. Bee venom is used for thousands of years for multiple issues,
Where
including
does that bee venom come from?
bee venom comes from bees. You can actually
Oh,
have
bees venom.
yeah, bees. You can have a therapeutic application of bee venom. You can have, we use maggots on the dead skin, right? Now we use leeches for all kinds of things. So these are, again, symbiotic relationships between the animals and humans uh, that give you a tremendous therapeutic value. So that's exactly where it belongs.
Yeah.
But because it's hard to make money on it, nobody really wants to promote it. Nobody really wants to.
Yeah, I agree. I think part of it is also not a lot of people know about it. For example, like I didn't know until I saw, your video and I reached out. But,
In the U.S., we don't know anything about it. I mean,
yeah,
there are few people like myself and few people who came from other countries where people seen it, used it in action, had it done on themselves. But in the United States, mainstream, there are a little bit more of application which is acceptable in the United States for cosmetical purposes. So because the leech has hyaluronic acid in it, believe it or not, so it's the same hyaluronic acid that you inject into face and you treat. There are a few applications of hirudotherapy for cosmetics. I mean, I can give you a facelift with the leech. I can restore
wow,
your hair growth with the leech. Demi Moore is famous for promoting this type of stuff, and she's used it herself for years. There is a person in Los Angeles who does this for cosmetic purposes. All the PRP that we inject, right? The leech does the same thing, Oscar. I'm your competitor with the PRP for cosmetics. Does the same thing, but it also delivers more than just rich plasma, and it has so many components. It reestablishes the collagen structure. It treats the scars. It breaks down the scar tissue and reestablishes normal healing of the tissue.
yeah,
For cosmetic purposes, it's a little bit more acceptable. Yeah.
interesting. And one thing so how long is a therapy usually? I know depending on the session.
So the leech will latch on. You prepare skin. Skin has to be warm, so it's a little bit of the preparation. You cannot have a patient wear any perfume because leech can smell.
Mm,
You clean the skin with the soap, regular soap, not scented soap. Warm skin, leech will attach. The moment the leech attaches, uh, it will inject the saliva for the first 20 minutes. So that is usually enough to deliver the medication. But if you want to accomplish the drainage, you're going to leave the leech for maybe 45 minutes. So
mm,
the session will probably last around 1 hour altogether. Now, after
mm.
session, There will be bleeding, and the bleeding should not be stopped if you try to accomplish the drainage. And sometimes you would encourage person to go and put their foot, let's say if you're treating a foot ulcers, you would ask them to go home and put the leg in a hot water so the drainage can continue. Uh, Sometimes in Ayurvedic medicine, you would put turmeric on the wound. But again, because I'm a medical doctor and in my office I cannot put non sterile material on the wound, I don't do that. But it is a perfectly acceptable practice to put turmeric on the wound to stop the bleeding after the treatment.
So you tell that to your patients and they do it at home usually?
I don't. Again, with my license, having a medical license sometimes is a blessing, sometimes it's a curse. I'll
Yeah.
tell you why. Because I cannot tell them that they can actually put turmeric. Because God forbid something happens. That turmeric was not sterile. There you go. I just broke my first
Oh,
obligation to do no harm. Believe it or not, there's so many applications that
wow.
I can be using the leech for, but I cannot because of my medical license. I will give you an example. I told you that Egyptian pharaohs used the leech for fertility treatment. For a woman, it's a beautiful fertility treatment because sometimes, if the fallopian tubes are scarred, the egg cannot
Go
go
through.
through. The sperm cannot swim toward the egg because of the scarring. So what you do, you would break down that scarring with the hirudotherapy, with the leech, because I told you it's a biological scalpel.
Yeah.
And the most effective treatment is actually intravaginal application of the leech, which is done on a daily basis in Russia by GYN physicians, trained GYN physicians. You can even do it externally as well. But now, Oscar, I'm a man. We are in the United States. If something goes wrong, lawsuits are going to be coming to me. Okay. Another
And
funny
then,
subject.
and Dr. Yen, even like if you have like a consent form and you give them like that.
I refuse. I refuse this on a daily basis. It is a. I'll tell you what. It's a beautiful hemorrhoidal treatment. If you have a painful
Mhm.
hemorrhoids, there is nothing better than a leech.
Yeah,
You can put
makes sense.
suppositories. You can unless you send them to a surgeon to excise the hemorrhoids. There is really no treatment. Leech will do the treatment without surgery. But for me to put a leech on a sensitive part of the body,
Yeah.
I'm inviting. I'm opening myself up. Even if I sign consent, people
Mhm.
are. I
Yeah.
just can't do it.
Yeah.
I'll give you another example. You asked me about cancer treatment. Can it help with the cancer? Absolutely, it can. It can boost the immune response. It can help the cancer with symptoms. I can drain the lymphatics from the congested tissues because of the tumors. I can potentially deliver the medication to help with pain in cancer patients as a palliative treatment. But also, imagine this: how do I know that I'm not quote unquote spreading the cancer by moving blood from one organ to another and essentially redirecting the blood channels? Because somebody's going to come to me and they'll say, well, Dokukin, it was not metastatic, but now it is metastatic. Your leech did this. It is tragic. It is tragic to operate in the legal environment that we're in. But because of the
Mhm.
legal environment that we're in, half of the things that I can do with hirudotherapy, I cannot even speak about or advertise.
Wow.
In Russia, please be my guest. People have a very different understanding. You have a. I was trained how to apply leeches intravaginally. I was trained how to treat hemorrhoids. I was trained how to do cancer. But in the United States, I will not do that.
Wow. You say that, and it's unfortunate. It's
Yeah, it is.
unfortunate.
It
It
is.
is very unfortunate, and that's what Western medicine is. And I believe in all of this. I believe in naturopathic, holistic approaches.
I mean, it doesn't get any more natural than this, and it
No,
doesn't
I
get any
agree.
more holistic
I agree.
than this because
Yeah.
you can actually treat. Look, I can deliver the medication to inside of your skull to treat strokes. I can treat psychiatric disorders. I can treat alcohol withdrawals and cravings. I can deliver the medication to your pineal gland, which is sitting inside of your head, by using arterial and venous structures. I can drain the venous congestion, giving you headache reliefs. I can treat your heart. I can
Um,
treat your pancreas. I can treat your kidneys. I can treat your liver. One of the most beautiful applications of hirudotherapy is a liver cirrhosis. What do we have in this country? Liver transplantation. That's pretty much it. I can break down the scarring inside of the liver, in the cirrhotic liver, for the liver to be able to boost it to the regeneration. We don't do that
no,
because it's just uh,
yeah,
so it doesn't get any more holistic than this, Oscar.
yeah, no, I understand. Wow, that's amazing. Well, yeah, I mean, do you have anything else you would like to add? I know we've already gone a little over an hour.
No, listen, I'm excited about this. This is an amazing, amazing field. The sky is the limit. What you can do with hirudotherapy. Um, there are different techniques. There are different. Even if you grow the leech, the size of the leech will depend on what kind of saliva it has. The temperature of the leech will can. There's so many modifications that you can do. There's so much literature that exists. And again, I really, really, really hope that in the United States we bring this. This is a renaissance of hirudotherapy in the entire world, because I think the people are a little bit more ready to this. With the huge disaster with pain medicine in this country, I think it was one of the biggest mistakes in the field of medicine since the medicine was ever even created. That we decided to treat everybody with narcotics. Why? We have hirudotherapy we used for millennia. There was nothing wrong with this in the first place. I think people are ready for something different. People are ready for something new, and I
I
just
agree
hope,
with you.
yeah,
Yeah.
I just hope that I can continue to come and talk about this and promote it, and be the pioneer. And I welcome anybody who wants to join me. I will teach. I don't charge yet for that.
You're gonna get so many phone calls. Hey, you said you won't charge me.
Well, call my office, 562 leechmedicine.com, leechmedicine.com. On the social media, I'm the Leech Doctor. So come check it out. Fly down to Los Angeles area. We are in the Bellflower community. We're in the Bellflower Medical Center. And yeah, let's have more conversations. So
Yeah, I'm interested in it, and we'll spread more awareness, and I'll definitely help you and spread the word. Okay.
thank you for giving me a chance to talk about this.
No, you're very welcome. Thank you for sharing your knowledge. That was amazing. Honestly, I learned a lot.
I'm glad. I'm glad I
Yeah.
did.
Alrighty. You guys have a good day.
All right, Oscar. Thank you.